Stego, Scano, Giwe de no Quay in the Dishakash, magazine do dam, Ma May and Snave and Dow, Kiddigan ZB and Don Java. Greetings, my name is Dr. Deb Meness. I'm originally from the Anishinaabe territory of Kiddigan ZB. I have strong roots in Six Nations. My mom is Mohawk from Six Nations. I'm very glad to be working here in your community as a physician. I've been here now almost 3 months. I am a family practice board certified physician. Very much enjoy being here and being around all the Haudenosaunee people and learning more and more about that part of my my heritage and background and culture. Yeah. So there was one question that was posed. That one question was from a person who had indicated that their husband was COVID positive, and the question was, do they continue? That they've had repeat COVID testing and they are continuing to be positive. That their work is insisting that they have to be negative in order to return to work. How long do you stay out of work? How long do you stay quarantined? We advise people that when they become positive, that they stay quarantined for 14 days. And then after 14 days, they are no longer contagious, but that you may still continue to have a positive test. And so we also recommend that you not get repeat testing after you've had that one confirmation confirming that you were positive. It's then that because we know that you will remain positive in some cases up to 3 or 4 months is what the information literature talks about. But you're not contagious. That's the point, is that after the 14 days, once you've isolated and quarantined yourself for 14 days from, when you have a known period of time of when you were contracted the virus, that you isolated, quarantined for a full 14 days, that you're no longer then contagious to spread the virus. Also, during those 14 days, you are also making antibodies. So your body is fighting the virus. It's the antibodies that protect you from getting the virus again. So we do know that once you are, once you had become positive and you finished your quarantine, your body is making those antibodies, which is what the vaccines are giving us. You take the vaccine. Here we do the Moderna vaccine, which has a 95% effective rate. That you take that vaccine and you wait approximately 2 weeks it takes for your body to start building antibodies. So even with the vaccines, even though you're not being exposed to the virus, you're still at risk of getting the virus. So you need to continue to practice the mitigating practices of staying 6 feet away from people, only relating with people in your own personal family bubble, continuous wearing masks whenever you are venturing out or with anybody, outside of your family bubble, and that you continue to wash your hands frequently, or use alcohol wipe solution that's at least 70% alcohol. So the both are creating antibodies, and that's what we want. We want to, hopefully people don't get the virus, because the virus, of course, can put you into, more precarious, dangerous health situation. We don't want people to get the virus. We don't want them to end up in the hospital. So the vaccine helps to mitigate those symptoms. So people who do, contract the virus and isolate, quarantine, and come through the other side of it without having to go into the hospital, they are building up antibodies. So they are becoming immune to the virus naturally. We don't know how long that's going to last. So even though you may have contracted the virus and you're positive, or somebody who has tested positive, that they quarantined for the 14 days, they are no longer contagious. And some places do suggest a second test, but it could be positive still, and it could be positive for a while, but you're not contagious because it's pretty much the counties that are controlling that aspect of verifying those numbers. I'm not sure. I'd have to double check with Dr. Kelly about whether or not we can verify with verified tests that you are that we can give you a note back to work. Last I heard, and it changes frequently. The last I heard is that we needed the letters from the counties in order to verify that you can go back to work. But the bottom line is, after 14 days, you are not contagious and that you are developing immunity. And we know right now that that immunity may last up to 90 days. And so that even if you had contracted the virus and you came through the quarantine and you're finished your isolation, right now the estimates are that immunity, that natural immunity, will last about 90 days. They are recommending that people who even had the virus, that they still should get vaccinated, that they need at least one, preferably two, of the vaccine doses. The Moderna is a 2-shot regimen. The Pfizer is a 2-shot regimen. That we started with the Moderna, and the studies all say that you should stay with the same vaccine that you started with and not mix them. So we started with the Moderna. This now is a Moderna clinic, Moderna community. We will be continuing to give the Moderna vaccines. We're scheduled to give a large percentage of them again this week based on the priority list. But here we do, as I said, we do the Moderna. And again, I would recommend that you call the county about the person who, about getting the verification that that you are no longer contagious and they're able to return to work. So that's all I had. Yeah.